A patient with a history of alcoholism develops confusion, ataxia, and nystagmus. Which vitamin deficiency is most likely? Correct answer is option A, vitamin B1. A post-op patient suddenly develops dyspnea, tachycardia, and pleuritic chest pain. What is the nurse priority action? Correct answer is option B. Apply oxygen. A diabetic patient with a blood glucose of 42 is unresponsive. What should the nurse administer first? Correct answer is option C. IV dextrose 50%. A patient with heart failure has a potassium level of 2.8. Which medication should the nurse hold? Correct answer is option D, digoxin. A burn patient develops facial edema, horrescence, and steroid. What is the nurse's immediate action? Correct answer is option B, prepare for intubation. A postpartum patient has a BP of 160 over 110 and 4 plus proteinuria. What complication is most likely? Correct answer is option B. A patient with Parkinson's disease develops hallucination. Which medication is most likely responsible? Correct answer is option A, levodopa carbidopa. A patient with Addison disease develops vomiting and hypotension. Which lab result would you expect? Correct answer is option D, all of the above. A patient with a head injury has a Glasgow Coma Scale score of 6. What is the nurse priority? Correct answer is option B, prepare for intubation. A patient with a spinal cord injury at T4 develops a BP of 190 over 110 and bradycardia. What is this called? Correct answer is option B. A patient on mechanical ventilation has peak airway pressures rising from 20 to 45. What is the nurse's first action? Correct answer is option C. A patient with a supraconite hemorrhage develops a BP of 220 over 120. Which medication should be prepared immediately? Correct answer is option B, nitroprusside. A patient on warfarin has an INR of 8.5. Which reversal agent is most appropriate? Correct answer is option D, vitamin K IV. A patient receiving vancomycin develops red man syndrome. What is the nurse priority intervention? Correct answer is option A, stop the infusion. A patient with atrial fibrillation has a heart rate of 160 bpm and BP 80 over 50. Which treatment is most urgent? Correct answer is option B. A patient with STEMI develops sudden GVT, muffled heart sound, and hypotension. What complication is this? Correct answer is option A, cardiac tamponade. A patient with Guillain-Barré syndrome has a vital capacity of 400. What is the nurse priority? Correct answer is option B, prepare for intubation. A patient with a basilar skull fracture has clear drainage from the nose. What should the nurse test for? Correct answer is option A, glucose. A newborn with meconium-stained amniotic fluid is floppy and apneic. What is the first action? Correct answer is option B, intubate and section. A pregnant patient at 32 weeks has BP 170 over 110, epigastric pain and platelets. What is the priority treatment? Correct answer is option C. A patient with DKA has pH 7.15, HCO3 10 and K positive 5.7. Which intervention is contraindicated? Correct answer is option B. A patient with cirrhosis has ascites and an albumin of 2.0. Which IV fluid is contraindicated? Correct answer is option A, 0.9% NaCl. A post-op patient has absent bowel sounds and vomiting green fluid. What complication is this? Correct answer is option B, small bowel obstruction. A patient with a recent thyroidectomy develops stridor and spasms. Which medication is most urgent? Correct answer is option B, calcium gluconate. A patient with leukemia has white blood cells 80,000 and confusion. What is the priority intervention? Correct answer is option B, initiate leukapheresis. A patient on chemotherapy develops temperature 102 and ANC 300. What is the nurse priority? Correct answer is option C. Which findings indicate increased ICP? Correct answer is option A, B and D. The normal respiratory rate in an adult is. Correct answer is option B, 12 to 20 breaths per minute. The hormone responsible for regulating blood sugar is. Correct answer is option A, insulin. Which of the following is a side effect of chemotherapy? Correct answer is option B,